Hello and welcome to another remote edition of Currently in Quincy. I'm Joe Catalano, and on today's program, we speak with Quincy nurse Debbie Ponapane, who returned to a hero's welcome last week after recovering from COVID-19. First, though, we check out the news for you on this windy, rainy Monday. Currently in Quincy, there are 647 cases of coronavirus. There have been 59 deaths, and 252 people have recovered from the virus. Quincy Health Commissioner Ruth Jones says the vast majority of the deaths in Quincy have been in nursing homes and that almost all have had underlying health conditions. City of Quincy and Bay State Community Services of Quincy have teamed up to provide help to people struggling with substance use disorder during the pandemic. A special phone number has been established to offer virtual 12-step meetings, one-on-one peer support, treatment referrals, medication-assisted treatment referrals, and linkage to housing support and other services. That service is available 24 hours a day, 7 days a week. Call 617-479-3700 or contact Quincy Substance Use Prevention Coordinator Laura Martin at lmartin@quincyma.gov. The Quincy School Committee will hold another virtual meeting on Wednesday to determine how to move forward now that schools will not be reopening for the remainder of the school year. Officials will discuss issues including grading, report cards, graduations, and other year-end activities. Online learning will continue through June 17th, and grab-and-go meal packets and learning enrichment materials will continue to be distributed weekdays from 11 a.m. to noon at Quincy and North Quincy High Schools and the Snug Harbor, Lincoln Hancock, Clifford Marshall, Atherton Howe, Parker, and Montclair schools. The meals are being offered to everyone. Reminder for you from the city clerk's office to call them if you have questions about what is an essential and non-essential business in Quincy. Call 617-376-1131 for more information. The city clerk's office is also issuing a reminder to please complete your 2020 federal census. Mannett Community Health Center of Quincy says they are seeing a 16% positive testing scenario as they continue to operate their drive-through COVID-19 testing tent at their West Squantum Street headquarters in North Quincy. About 700 Mannett patients have been tested so far. Appointments are required. Mannett is also providing coronavirus testing for Quincy public housing residents and homeless clients of Father Bill's Shelter in Quincy. Quincy Police DARE officer Don Sauter recently tried to make a Quincy woman's birthday a little bit more special. During this pandemic, back on Friday, Officer Sauter summoned his inner entertainer and serenaded Marie from a safe distance in his police cruiser.
Birthday to you. Happy birthday to you. Happy birthday, dear Marie. Happy birthday to you.
Quincy police officers also recently were able to reunite a woman with her family after she became disoriented on the Four River Bridge. The woman did not speak English, but was enrolled in the Project Lifesaver program, and that helped the staff at Quincy Medical Center get in touch with her family. That program is available to any Quincy residents to help people with dementia, autism, Alzheimer's disease, or any other condition which may make them vulnerable. Coming up, we chat with Debbie Ponapane, Quincy nurse who recovered from COVID-19 after treating coronavirus patients. That's next.
Throughout our city's long, proud history, the people of our community have always stepped up in times of challenge. The public health crisis we're facing together today is no different. I can't tell you how many people over the last several weeks have called with a very simple question: how can I help? I'm so heartened by this deep sense of community. That's why we're launching the Quincy Relief Fund to help support our friends and neighbors in Quincy hardest hit by this crisis. All monies raised by this effort will go directly to individuals and organizations in the most need during this difficult time. The program will be administered by the Quincy Foundation, a registered 501c3 nonprofit corporation with a mission under normal circumstances to provide charitable contributions and put on the Flag Day Parade and our local Christmas festival activities. Please go to thequincyrelieffund.com to find out more and donate. My friends, our community is strong. Our commitment to each other is strong. We will get through this together, and any support you can give our neighbors right now will go a long way. Let us keep in mind those that have been affected in your prayers. May God bless you, and stay safe.
So I really just wanted to give you an opportunity to, tell folks about your experience, first taking care of people who were sick, and then being cared by by people
Yes.
because you were sick.
Yes. Well, I do. I work in the Brigham and Women's Emergency Department. I've been there almost 31 years, and I don't know how I contacted COVID-19, but when I did work, I took care of really sick patients, and they were very ill. And I became a patient myself on April 8th. I was in my bedroom, and I couldn't get out of bed. And I felt like someone was stabbing me with knives through my ankle joints and through my kneecaps. And I said, this is really an odd feeling. Got to my bathroom, I took my temp, I was 102.
Oh.
So Brigham requires that you fill out a COVID pass before you come to work. So I obviously failed it. I called occupational health. The next day I went and got tested. And Friday, the Quincy Health Department told me I was positive.
Wow. What did you think when you heard that news?
I wasn't surprised because of the way I felt.
Yeah.
I wasn't surprised, but I was so sick. I didn't know what to think. I'm thinking, okay, I'll be better tomorrow. And I never, ever, ever got better. I got worse.
So did they have to put you on a vent, Debbie?
No, I was not intubated. I finally went to the hospital. I called the ambulance. My daughter actually called the ambulance for me because I called her and I said, I can't breathe. And this was like maybe after being diagnosed, maybe 5 days later.
Wow.
And the fevers were still 102. And my breathing was really hard. I couldn't take a deep breath. It got to the point where I couldn't even walk without such shortness of breath. And I am not a smoker. And I said, okay. I called the ambulance, and they took me to the Milton ER because it's the local one. And from Milton, I got myself transferred because I'll be honest with you, Joe, I really thought I was going to die.
Really?
And I wanted to die at the Brigham because
Wow.
that's my hospital.
Yeah.
If I was going to die, I was dying at the Brigham. That's the way I felt at the time.
Right.
Now I don't feel that.
Yeah. And I'm sure just a familiar surrounding and familiar faces were helpful for you.
Yes.
Too. Yeah.
Yes. You go to a job for almost 31 years. It's your home.
Right.
The people that work there, they're great.
So what would you say, Debbie, to folks who are saying, oh, this is just the flu, this is such an overreaction, we shouldn't be going to these extremes?
I think people should take it much more serious.
Yeah.
I think they should stop throwing their gloves on the ground. It makes me angry when I see them not walking with masks on. Just all you have to do is just follow the rules. The president has said it. The governor's said it. Social distance, wear a mask, wash your hands, and throw your gloves in the trash. It's very simple. If we all could just do that, this virus wouldn't have spread so rapidly. We are not on a lockdown. We're on a stay in. And it's a very good policy to have right now.
Sure.
There are so many people dying, and I feel so bad that here I am home and thankful to God, but I know there's a lot of death in the hospital, and it's very sad for a lot of nurses.
Yeah. Did you lose some of the patients that you were taking care of?
I never did. You know, I always transferred my patients to the floors where we don't really know what happens to them there.
Right.
But we do know that there have been unfortunate outcomes for
Sure.
patients.
Yeah. And the hardest part that I've heard is that families can't be with them at that time to say goodbye.
Yeah, there is a no visitor policy.
Right.
There are some exceptions, but there is no visitor policy. Even for myself,
Yep.
it was a very lonely time. It was
But-
very lonely and scary and sad because, and I actually will tell you the truth, I didn't want anyone to visit me. Just the thought that I could infect someone else, oh my God, that bothers me so bad.
Sure. Will you go back to work when you're able?
Yes, of course.
Yeah.
I love my job.
Yeah. Yeah.
I've loved it. I've loved it for 31 years. I'm an ER nurse. I was a EMT years ago. I was a United States Navy lieutenant in the Nurse Corps.
Well,
So nursing is my life.
well, thank you for your service to the military and your service here at home as well.
You're welcome.
What's the protocols now, Debbie, for your recovery? What do you have to do?
Well, I'm still COVID-19 positive, so when I'm symptom-free, I'm off strict isolation. Quincy Health Department calls me and asks me how I feel. So they're going to call me back tomorrow. I'm still somewhat quarantined, but once I'm off strict isolation, I could go out with my mask on and maybe my backyard or whatnot.
Mhm.
And that's it. I have to stay in the vicinity of my own home.
Okay. And have they given you any kind of timeline as to how long that might take?
It all depends on me. I called my job today, my boss, and she just said, take your time. We're here for you. And whenever you're ready, you call us. And
Yeah.
then I have to go to occupational health. I have to have 2 negative COVID-19s before I'm able to return back to work.
I see. Okay.
So I know I have 2 more of those horrendous things go up your nose.
Yes. Is it as uncomfortable as it looks?
It's very uncomfortable.
Yeah, I bet. Yeah.
It's like you really want to punch the person doing it to you, but I almost did.
Is
So,
that right?
and I've swabbed people myself, so I always tell them don't hit me. So I stand way in the side and I do that myself. And,
Yeah.
It was tough being on the other end, getting it in the nose. Oh my God!
Yeah.
And I had it done 3 times in the hospital.
Wow. Yeah.
It's
So
tough.
do you think, going through this whole experience, it'll give you a different perspective when you're taking care of folks that have COVID-19?
Yeah. Well, I've always taken good care of my patients.
Of course,
I've been
yeah.
told I'm an excellent nurse, and I do feel like I am. But I will tell you this. I have a different appreciation of someone saying, I cannot breathe, and you're COVID-19.
Hmm.
I can actually say to them, I understand
Right.
exactly what you're saying.
Yeah. People are lucky to get you for their nurse if they go through that. Yeah, for sure.
Yeah, I do advocate. I advocate a lot for my patients, and the doctors at Brigham Women's in the emergency room, and the PAs, and the attendings. They know that you've been a nurse a long time, and they honor whatever you say, whatever you ask them for, and the cooperation that we have together for all of our patients.
Mhm.
We do the best we can to take care of them,
Yeah.
and I do advocate a lot for them.
Sure. Now, what we've heard is the shortage of gloves and masks and gowns. Is that an issue there too? Do you know?
I don't believe so.
That's good.
I don't believe so.
Good. So, what did you think about the big homecoming parade for you? Or did you expect that?
No, I didn't. I was, whenever they wheeled me out in the wheelchair, oh my God. And I saw the Quincy police, I'm like, oh my God. And I'm like, okay, what is, I kind of thought they're taking me home. The Quincy police is actually taking me home. And I felt so honored. I felt like I was back in the military. I have a deep appreciation for officers of the law anyway. I always did. They are my heroes. military people, sheriff's departments, all of that. They are people that I look up to. And when they were zooming by me on their motorcycles, and my daughter was driving my car, and they would slow down and say, "Make sure you follow that guy in front of you." We were going so fast on the expressway, and the helicopters were above me watching, and I'm waving to them. And I guess one of them, I think Channel 4 got me waving through my skylight. I'm really not sure. It was an honor.
Yeah.
I felt the Quincy Police Department could not have made me feel more special.
That's great.
And I did tell them when I got here, I go, "Man, I never got home so quick from the Brigham."
You have that every day, right?
Never. It would be nice.
Yeah, that's great. So you're in your home, but yet you're kind of quarantined in a separate room in the house. Is that how
I'm in my bedroom again.
Yeah.
I have my own bathroom, like it's 2 seconds away.
Yeah.
I have to put a mask on. I have my Purell. I have to Purell going out of my room. Come back in my room. My husband has been preparing my meals. He does everything, washes every time I come out of the bathroom, he disinfects everything.
Mm-hmm.
He's been nice to have here.
Great. That's great. So do you need anything at all, Debbie, from the community at all?
No.
Yeah.
I just want the community to know, thank you for everything they've given me. The fire department,
Yeah.
we're all lined up and thanking me. I think everyone, they need to be thanked too.
Okay.
They're also on the front lines. They're police, fire, all essential workers. They're out there with their PPEs on and trying to help with the best they can. And they know I appreciate them.
Sure. Let me ask you, I know you're a breast cancer survivor
Yes.
also. What was harder?
That I think anytime you go through a tragedy, it's hard going through it. When I went through breast cancer, I had a 1-year-old and a 9-year-old, and I was a single mom, and that was hard too. I had to go through chemotherapy. I lost my hair. I lost my eyelashes, my eyebrows. I was faceless. I couldn't walk. I couldn't do anything at the time, but because I had 2 children, I fought to live. Now that they were a little older, this COVID-19 was a little different. When I felt like I was going to die, I said, well, I know my children will be okay. They're older now. And I lost my brother to cancer in December of 2019.
Oh, I'm so sorry.
And every day I would sit at the window in my room, and I look out far, and there was a flag that would just fly. And, I love the American flag. And an eagle every day would circle my window. It would just keep circling the window. And I just kept thinking it was my brother, Jimmy, saying, "It's okay, Dad. You'll be all right. And you're going to go home." But I never felt so bad in all my life. I never felt that inability to breathe. And I don't think people realize what COVID-19 is. I don't think people realize how serious it is. And they need to take it serious. People are dying, young, old, and they need to look at that. We don't have our newscast people home in their house doing Zoom for no reason. Our schools are closed. My son lost everything in his senior year. He's a senior at Quincy High School. And one day I called him crying. He goes, "Mom, why are you crying?" I go, I'm sad because you lost your prom, your graduation, your hockey banquet. He was a great hockey player, and he lost everything. And I felt so bad. I feel bad for all the seniors this year and all the schools, but especially my son.
Sure. Yeah. Well, he's pretty lucky that he got his mom, and I'm sure he feels that way too.
Oh, yes. He's happy I'm here.
Yeah. So I really appreciate your time, Debbie. I don't want to, exhaust you any more than you already are. Anything else that you wanted to add?
No, I just want to thank you, and I want to thank God for giving me my life back here.
Well, thanks for your time. Be well, and if we can be of any help here at QATV, reach out and we'll make it happen for you.
Okay.
All right.
Thank you.
All right. Be well.
Bye.
Bye-bye. Special thanks to Quincy nurse Debbie Bonapane for joining us today. Thank you to our crew working remotely from home, and thank you for watching. Reminder, please send us your videos of life at home during the coronavirus pandemic. Just email your videos to covid19@qatv.org, and then watch for your story soon on Quincy Access Television Channel 8. Also, a reminder to visit our website often, qatv.org, for up-to-date information and programs on the crisis, as well as other special programming. And do please like us on Facebook and follow us on Twitter. For all of us here at Quincy Access Television, I'm Joe Catalano. Please stay safe.